Hello. Hi, everybody. Are we live? Are we on? Are we off? Let's see. It says live. Hashtag Tuesday. Hello. Yes, I think we're live. Okay. They said I had bad reception, so I don't know. Hopefully it's working. Hopefully you can all hear me. Hello, everybody. Singing Dent is here. How is everyone? Hope you're all well. It's Tuesday night. We have our first hello. That's from Zelia. Hi, Zelia. How are you? Lewis Bridle saying, hey. How's it all going? Jerry Zanika, how are you? Hey from Belfast. That's from Victoria. Hi, everyone. This is good. People are logging on. 170 people already. Great. So, another Tuesday, another Tuesday. Here I am. We've got hello from Essex in it. That's from Nyla. Hi, Nyla. Suzanne Dent wants a shout out. Oh, it's all gone a bit orange all of a sudden. I look like I've been tangoed. Oh, and then we're back again. It's weird. What's going on? The camera's doing some nuts things. I keep going orange. Orange. White. Right, anyway. John Rose wants a shout out. All right, how are you, John? Said. Hey, mate, your beard looking awesome. Thank you very much. I got a nice shave up yesterday. Who else we got here? Pippa, Melody, Holly, Ayub is saying hello from Morocco. International business. We got Martina saying much love from Kentucky. Wow. Hi, Martina, all the way from Kentucky. The fried chicken is amazing over there. Beth Price from Michigan. Hello from Queens. Is that Queens as in Queens, New York? Really? Wow. Hi. We got Luana saying hello from Brazil. Obrigado. Giovanni saying, I'm a nurse. I'd like to work with you. This is fantastic. Victoria saying, because of you, my kids love the dentist. They're 11, 8, 6, 5, and 2. Wow, Victoria. First 5 children. Amazing. Very busy. That's good. We've got hello from Uzbekistan. It's amazing. This is going on everywhere. Beverly Bob say, what's on your t-shirt? Funny you should ask. Here's one of my favourite t-shirts. Look at that. It's, for those of you that don't know, it's Rocky characters, but drawn in a cartoon style. It's Rocky. If he dies, he dies. I pity the fool. I pity you. You nothing. Pity the fool. Can't do Apollo. Don't really know what he sounds like. Hey, Rock. I can't do Apollo. Sorry. Anyway, that's my t-shirt. Hello from Hungary. Hello from Tunisia. Hi from Copenhagen. Hello from Liverpool. Hello from Egypt. This is amazing. Literally international, everyone. Right, so we've got nearly 600 people logged in. And I've been talking for how long now? 3 minutes. And I've had no dental questions. It's amazing, isn't it? I come on here to maybe talk a bit about teeth. And all I get is shout outs and hello from all over the world. It's great. Thank you so much for logging on. Thank you for coming on to say hi. No questions still. Yes, Jamie is saying you got Rocky, Ivan Drago, Clubber Lang, and Apollo Creed. I know, look at the t-shirt. It's so cool, huh? I love this. Anyway, much love from Allentown. Hello from Morocco. Tunisia saying hi. Kelsey saying, every time I hear Shape of You, I sing your version. Thank you very much. Sorry if I've ruined that song for you. I mean, it's been number 1 for like 11 weeks or something over here. So, right, here's a question. Have you ever had a patient throw up dental trays put in their mouth? I've never had a patient throw up, but sometimes they do gag a little bit. So when you put the thing in, it makes them kind of retch a little bit. So I've had that before. Johnny's saying, show us them pearly whites. There you go. Here we go. Hello, SD. Quick question. Is it normal for your teeth to hurt when you're tired? Or do I have to see the dentist? When they're tired. Not really. Do you feel a bit run down? Do you feel stressed? Maybe you're grinding your teeth? Don't know. Your teeth shouldn't really hurt if you get tired. If you've been using them all day, if you might be grinding on them without knowing or clenching your teeth together, just like this all day long, that could be going on. Right. Question here. What's your favourite dental procedure? To be fair, I like them all, just at different times. You know, sometimes I'm in the mood to do a nice root canal and that's all good. Other times, you know, doing some crown work is nice. Other times, braces. I like doing braces. So, all a bit different every time. We've got hello from Germany, from Sarah. Hello. I was on RTL, I think. Did you see it? Maybe check it out. Abby is asking, when is your next song? That's a very good question, Abby. I am trying to figure that out myself. I've got loads of songs done already, written, but you know the next one's got to be so good because the Ed Sheeran one was so big. I've got to make sure the next one is really good. So I don't know what I'm going to come with next. So I'm going to wait and see what happens over the next couple of weeks. What's the next big tune? I know Drake's just dropped an album. He's here doing loads of concerts. Let's see if one of his songs off the album is a massive hit. If it becomes a banger, then I might do that one. See what Bruno Mars does next. See what Adele does next, you know. So we'll see. Right, here's some questions. My wisdom tooth is coming in and it's very painful. Is it, I've had a bit of blood around it and a flap of skin. Is it normal? Yes, it is. So that flap of skin, it's called your operculum, and sometimes you can get food that gets under it and it can get a little bit infected, and that's called pericoronitis, and that can be quite uncomfortable. So if you look those things up, basically you need to give the area a bit of a clean, a bit of a rinse. Your dentist can do that for you as well if you're in quite a lot of pain. It's just the way it is. Hopefully the tooth will grow through and that bit of skin goes and the tooth will settle in. If it doesn't, you have to just sort of keep an eye on it, see your dentist, and then it may warrant removal, but you have to have an assessment to make sure it's safe to do so. Right. Why are root canals tricky and often cause an abscess? Okay, that's an interesting question. By the way, we've got hello from Spain, hi from Los Angeles, from Brenda, LA. I've got a lot of family in LA, a lot of Iranians in LA. Oh yeah, speaking of which, happy Iranian New Year. Happy Persia New Year to all the Iranians out there. Salam Mubarak, Eid al-Sham Mubarak. Hope you have a great year. It was yesterday, it was the Iranian New Year. So shout out to everybody and Happy New Year. And I'll come back to that a bit later. But why are root canals tricky and why do they cause abscesses? Root canals don't really cause an abscess. Root canals are there to help teeth that have an abscess. So when your tooth dies off, inside the root canal can be loads of bacteria, loads of bugs. And what root canal treatment is designed to do is to clean out all those bugs and then shape those root canals so that we can put some fillings in them. And then we fill them with a rubber-based filling material, and that stays inside your tooth and seals the tooth. And hopefully then your body can deal with the little infection that's inside, on the outside of the tooth and the bone. And that's the plan. So root canals don't really cause infection. They're there to get rid of it. Sometimes they don't work, unfortunately. But yeah, if it's done carefully, it can be a good treatment option. What's the other thing I was going to say? Oh yeah, and they can be tricky because the anatomy of your roots. Sometimes the roots are nice and straight, so it's easy to kind of clean them. Other times the roots are really curvy, and then it can be a bit more difficult. So that's basically why. Right. Hello from Egypt. Shout out Jamie Lowe in Worksop. I think I fainted when you said my name. Brenda Bonilla. Wake up, I said it again. All the way from LA. LA. So what have we got? I brush my teeth every day and night, but my teeth don't look very white. That rhymes. I brush my teeth every day and night, but my teeth don't look very white. But as I recently discovered, it's due to what I eat and drink on a daily basis. Any advice? Okay, so you're talking about staining. Because basically, if it's what you're eating and drinking, so the things that stain your teeth mostly are tea, coffee, red wine, smoking. Spaghetti bolognese can do it, loads of that. Spag bowl, curries, curries mostly. So basically, external staining, if you use whitening toothpaste, that can sort of help a little bit. If you use some of these proprietary things from the chemist, that can help. Don't get any of the illegal dodgy stuff off the internet because you never know what you're getting. But if you want to properly whiten your teeth and actually change the internal color of your teeth, then you should see a dentist and use the proper stuff and get some trays made that fit your teeth and get it done. I'm still a bit jarred by the fact that I keep sort of going orange. I don't know if you guys noticed. Look, if I move about, I think it's the light. It's this overexposure coming here on my shiny head and it's ruining the shot like that. I should have put some anti-shine on before I started. What's the best thing to do for sensitive teeth due to grinding your teeth overnight? Okay, if you're grinding your teeth overnight, the best thing is to get a mouth guard made. It's a little splint thing. You put it on your teeth and it helps and stops the grinding. There we go. Right. Here we go. I'm terrified of the dentist. I'm in desperate need of treatment, but I start a course when my nerves get the better of me. Is there a way I can overcome my anxiety? That's from Danny. Yeah, it's very difficult. I know a lot of patients, people are afraid of the dentist. we need to find out kind of what you're mostly afraid of and just work with you and just see if we can get over that sort of fear. For some people, it's the fear of maybe injections, possible injections. For some people, it's fear of the unknown. They don't know what's going to happen in their mouth. For other people, it's fear that they're not in control of what's going on because it's inside your mouth and you've got to trust someone to sort of be in there. It could be a bad experience you've had in the past with a specific, treatment or something you had. So you just got to work with your dentist. And believe me, we're not there to cause pain or hurt you guys. We're there to be nice and help you guys. Someone is saying here, sing Shape of You parody. You guys want to hear that? Shape of You? I can sing it. By the way, I'm a bit tired today. I've had a very busy couple of days. Yesterday was World Oral Health Day, and I visited a hospital here called Great Ormond Street Hospital in London. They're a children's hospital. They do lots of fantastic work with little people, and it was nice to go and kind of see the people there, see the work that the nurses and the doctors and the dentists get up to there. And we did some ward rounds, and it was nice to kind of bring some smiles to some little faces yesterday. So that was good to go along. And I did a charity calendar for those of you that have bought it. Thank you very much. Here it is. I actually use it in my kitchen. Here is the charity calendar. Let me show you. Oh yes, the Singing Dentist calendar in aid of Great Ormond Street Hospital. So we were selling these and we raised £3,500. Amazing. So thank you to all the dentists, my friends, the nurses and hygienists that I know that were part of this wonderful calendar. £3,500 we raised for Great Ormond Street Hospital. It was lovely. So I gave them the check yesterday. And it was a great day. I enjoyed it, and it was nice to see firsthand the wonderful work they do. And then straight after that, I went onto the BBC and did a little piece there as well for World Oral Health Day, again, just giving advice. It was a bit like this, basically. I did a Facebook Live. So basically, I did a hashtag Tuesday yesterday on the BBC. So that was good. And today, there was a news thing in the news here in the UK about children's tooth decay. We still got a problem with it. I've been talking about it for the past year, trying to improve the situation, but we still got problems with tooth decay and children for something that is preventable. So hopefully the government will do something soon and we can make a change. I want to make a change for once in my life. I haven't actually parried that, but maybe that could be another one. Man in the Mirror? Let me see. I'll work on it. I just thought of it now. Anyway, loads of questions coming in now. How are we getting on here? 15 minutes. We've got 12 minutes 50, so 13 minutes. Right, let's do some rapid fire questions. Quick. Ooh, shit. What we got? Hello, how are you? I'm using charcoal powder to whiten my teeth. Would you advise me to use it? No! Charcoal belongs on the barbecue, not in the bathroom. Next question. What is the best and fastest way to whiten your teeth? See your dentist. I can't stop biting the inside of my cheeks. Are you peckish? Have you heard of this before? Do you have any advice? If it's happening accidentally, you might just be kind of doing it because you might need a bit of adjusting on your teeth. Some people just get into the habit of doing it. I don't really recommend it. Cheeks can get sore, and don't do it. Hi, Mr. Dentist. I'm scared of injections. My friend bought your calendar. Oh, that's nice. Vicky, why are you scared of injections? Just let me know. Hi. Do you have any tips on how to help a child with multiple sensory issues be able to brush their teeth for the full 2 minutes? Yes, so if there's lots of sensory issues, first of all, toothpaste. Do they like the toothpaste? Are they okay with the toothpaste? Sometimes the flavour can be a bit too strong. Sometimes the foaming up in the mouth can be a bit jarring. So try and use a toothpaste that doesn't have much flavour or no flavour at all and doesn't contain SLS, which is sodium lauryl sulfate, which causes foaming. There is a toothpaste called Oranurse, which exists, and that's pretty good for that, so you could check that out. And for 2 minutes, I mean, look, you got to do your best. If you can play a song, distraction, maybe if they like a certain cartoon or something, you can maybe distract them while watching it. If they're find when they're most happiest. Maybe they're happiest in the bath, so maybe you could brush their teeth while they're having a bath, just to kind of distract them and take their mind off it. But look, if you can cover all the teeth and give them a good scrub and the toothpaste isn't what's putting them off, then that might help you a little bit. Okay, hope that does help. Good luck. Please say hello to my sister Linda. That's from Donna Griffiths. Hi, Donna's sister Linda. I'm becoming a dental assistant, getting ready to take the DANB. Do you have any advice for me? What's the DANB? Let me know what that is. Hello from Switzerland. Hello. Best toothpaste in your opinion? Don't have one, as long as it's got fluoride in it. What does impacted wisdom tooth mean? It means it's stuck inside your jaw and there's no space for it to come out. My filling at the front of my tooth is changing colour and completely different to the rest of my teeth. If it's changing colour, it could just be staining. It might need a bit of polishing because the surface might be a bit rough. If it's completely different to the rest of your teeth, maybe speak to your dentist about it and get it replaced. That's from Charlie. Right. It's hard work, isn't it? I just did my first half marathon this weekend, raising money for Birmingham Children's Hospital. Well done, Pete. Good man. Hi, you're amazing. Congratulations for everything you do. Just a quick question. What do you think about Invisalign? That's from Maddie. Invisalign, it's a clear braces system, so it straightens your teeth with these clear aligners. They're the biggest company in the world. They've been around for a very, very long time. I do something similar with a company called SmileLine. They're UK based. I also lecture for them. So I like SmileLine, a very similar thing. It's just a bit quicker and costs a bit less. But yeah, Invisalign, they've been around forever. So yeah, if it works, if you choose the right case, it's a good form of treatment. Right. Any advice for getting into dental school? Work really hard, enjoy science, be good at with people, and be prepared for a long, hard but very rewarding career. Man, you are awesome. Do you practice? Yes, I do. I was working today. It was a very busy day today. That's why I'm a bit tired. So I'm just... Sorry, just nodded off for a sec there. I'm very tired. Say hi, Leah from Ireland. Hello, Leah. That was my Irish accent, sorry. Is vaping bad for teeth compared to smoking cigarettes? Ooh. So the jury's out on vaping. They haven't done enough studies yet to know. Is it better than cigarettes? Probably, but we still don't know. There's now studies coming through saying that it's not as good as first they thought it was going to be for teeth. So the best thing is still don't do anything, ideally. Listen, don't eat chocolate, don't eat sweets, don't smoke, don't drink sugary stuff. Just don't eat ever. Your teeth will be fine. Where did you go to college? Well done for this job. If you mean university, I went to St. Bart's and the Royal London School of Medicine and Dentistry. It's in London. It was lovely. Naturally straightening your teeth without braces. I don't know how you do that. I mean, you can push them with your finger until they move. I don't know. Naturally straightening teeth won't just kind of straighten if you ask them nicely. Doesn't really happen. You need to move them. Is baking soda good for tooth hygiene? I'm not a fan. It can be a bit abrasive. It can kind of wear the teeth a little bit, wear the gums a bit. Not so much. My daughter loves to sing a dentist. Oh, thanks. That's from Faye. Thank you very much, and a big shout out to your daughter. Wait, where are you from? I'm from Iran. And it was a rainy New Year yesterday. So once again, to all the Iranians out there, Eid al-Sham Mubarak. Hope you're all well. I've just seen a friend of mine, Payam, has just logged in from America. He's a dentist out there. Hi, Payam. Hope you're well. Love to the family. Salam Mubarak. Okay, I seem to have a habit of clamping my jaw shut at night. When I finally move my jaw, it's really painful. What can I do to stop it? So that's from Laura. Laura, it sounds like you are clenching. Like this. Stress related. Are you stressed right now? Stressful time. So that could be what it is. You can get like a little splint thing that you wear at night time. A little anti-grinding device. Or anti-clenching. So there's something called an SCI. If you Google it, sleep clench inhibitor. And your dentist can make you one of those. I wear one because I clench a little bit at night time as well. Do you love your job? Yes, I do. I get to help people and I get to be nice. Guys, I said I'm going to do 15 minutes. It's now 18 minutes. So I'm going to call it a day once again. But I will end it on a song. So I guess you all like the Ed Sheeran song. So I could probably do that for you, maybe. And someone asked what was on your t-shirt. Because I'm loving my t-shirt right now, I'm going to show you one more time. Check this out. Eesh. It's Rocky, done in cartoons. So this is Rocky. I'll do my impressions as well. So, hey Adrian, you know, you could be doing this. Yeah, Adrian. If he dies, he dies. I pity the fool. You fool. Pity you. And I said I can't do Apollo Creed. I still don't know what you... Hey, Rock. No, I can't do it. Anyway, that's it, guys. I'm going to call it a day. Very tired today. But I will sing my Ed Sheeran song for you because I know that's the only reason half of you come here is to hear me sing. So I will just go straight into it. The dentist isn't your favorite place, and I know you don't like to go Me and my nurse sitting here, we're wondering why you hate us so. We talk for hours and hours about preventing gum disease and tooth decay, but you don't listen to me. You keep on eating sweets and smoking 20 a day. That's why someone just asked for a dab. That's why I'm singing out. Girl, you know you need to brush twice a day. Then take that floss in between. My friend Mars said, "Are you in your PJs?" No, I'm not. Look. Go on now, follow my lead. I'm Mr. SD, please hear me. Someone said, "Where did you buy your shirt?" I don't know. Online, I think. Boy, you know you need to brush twice a day, then get that floss in between. Come on now, follow my lead. Someone saying, "Nice beard and love your shirt," all the way from Peru. Because my job is to save your tooth. So brush and floss like you need to do. You get toothache, I'm here for you. I've got 1,000 people watching. My job is to sit I'm here to help everybody. And last night you had Vindaloo, and now your breath kind of smells like every day when you brush, scrape your tongue too. That is good oral hygiene. Oh I, oh I, oh I, oh I. I heard Ed Sheeran's song today and I thought of you. Thanks, Beth. I'm here to help everybody. Oh I, oh I, oh I, oh I. And stop your teeth getting wobbly. What are your thoughts on MIH? That's molar incisal hyperplasia. Message me later and I'll tell you all about it. Oh I, oh I, oh I, oh I. I'm here to help everybody. Actually, let me show this as well. My beautiful wife has just brought something in. Look, just before I go, someone wants another dab. I went to my daughter's preschool a couple of weeks ago just to do a little bit on teeth and show the people. And look, I got a card and it says thank you. And this is me looking in my daughter's mouth and doing some brushing for her. So cute. Look. And there's some teeth. And in here, my daughter's done me a little picture. So sweet. And it says here, thank you for coming. I don't know if you can see that, but thanks a lot for coming to preschool. Look. Look how cute my daughter is with the little pigtails. Daddy's looking in her mouth. Love it. Anyway, guys, I didn't finish the song, but there we go. A dab was great. One more time. I don't know what it is about dab, but it kind of looks like you have like a mini sort of mini like seizure. Anyway, right, guys. All the best. Thanks again for logging in and watching this. I'll be back next week. Maybe I might be doing something next week. Let's see. But I will be there. Adam saying your version is so much better than Ed's. I really appreciate it. I really do. I disagree, but thank you very much. No, I appreciate it, guys. Listen, I've really got to go. Thanks again. Thanks for the support. Loving this t-shirt's gone down really well. And a finish with a dab. So for all you guys, brush your teeth and then dab. No, everyone. Take care. See you next week.